Bună ziua și bine m-am regăsit la o întâlnire cu totul specială marca Ce se întâmplă, doctore? Abordăm astăzi un subiect extrem de important pentru medicina actuală, tratarea unor afecțiuni grave cu ajutorul celulelor STEM. Invitatul nostru de astăzi este un specialist mondial de top în tratarea cancerului, bolilor cronice degenerative și în medicina regenerativă. Medicul Nils H. Thoennissen are peste 20 de ani de experiență în medicină și peste 14 ani de experiență în hemoterapie și transplant de celule STEM. Good afternoon, Mr. Thoennissen. First of all, thank you for being with us today. Can you give us more information about your career and your medical research?
Thank you for giving the opportunity to introduce myself. I'm looking back to almost 15 years, 15 years of being experienced in stem cell transplantation, also called hematopoietic stem cell transplant, treating cancer patients. Main focus on acute leukemia, myeloma, and lymphoma, transplanting adults in a kind of university setting, so completely exchanging the immune system by high-dose chemotherapy regime and radiation, and also bringing back a kind of new immune system with an anti-cancer effect, so-called graft versus leukemia or graft versus cancer effect by using hematopoietic stem cells. So I also went to Los Angeles, working with one of the best when it comes to cancer on this planet. And I'm always saying, if you're keen with cancer, if you're once aware how cancer works, how cancer divides and induces progression and metastatic spread, it's a small step to understand how regeneration will work. So I'm pretty proud to say that in the last three and a half years, I'm also cooperating with CBC Health, performing kind of regenerative approaches for degenerative diseases.
So this is an amazing and very actual field in medicine today. Let's talk about harvesting stem cells from placenta. What types of stem cells are in this fetal structure, and what are their potential benefits?
When it comes to regenerative medicine, and if you look at all the clinical trials and the bench work which has been performed the last 2 decades, definitely placenta is in the driver's seat. So placenta bears tons and millions and billions of specific mesenchymal stem cells, also called mesenchymal stromal cells, which bear a kind of pluripotency. So it's a perfect organ, if we talk about placenta, to be able to harvest for the patient itself, but also for donation purposes, very highly valuable stem cells for regenerative purposes. That's one thing which is worth to mention. On top of that, the placenta also contains not only the stem cells, which high regenerative potential, also the secretome. So that's the protein level and some nanovesicles, which has been secreted by the stem cells, also sits down in the placenta, and by its donation, someone is able to bring it down on ice and use it for the future. So we talk not only about cellular potential for cellular regenerative approaches, but also using placenta for non-cellular regenerative approaches.
What is a stem cell transfusion? What kind of conditions can you treat with this method?
Using specific stem cells, one big approach I already mentioned is to treat cancer, mainly hematopoietic neoplasias like leukemia and so on. On top, then that's the other direction. That's purely regenerative approach. The clinical trials have shown great success for so-called neurodegenerative diseases, including Alzheimer's, multiple sclerosis, also including cerebral palsy for kids and autism. Other kind of acute onset degenerative diseases for the brain is the so-called stroke, ischemic or hemorrhagic stroke. But also for other degenerative diseases, we talk about on metabolic level, diabetes. It's in high discussion for a scientific and also clinical trial settings, and also including ischemic or chronic ischemic heart disease. Not to forget also about pulmonary fibrosis, so chronic inflammatory diseases of the lung, kind of degenerative background. Also in this kind of setting, placenta stem cells definitely can help.
Is this a safe procedure? Are there any differences between transfusion and transplant?
That's a great question. And for many doctors, they're not aware that the so-called immunogenicity of the placental stem cells is very adaptable. So these cells are very immature, they're very young, they're very potent in its regenerative approach, but they can adapt to the new immune system. So far there is no graft versus host, so kind of rejection being noticed in the clinical trials. So it's a very safe procedure. And like I said, in the end of the day, it's a kind of simple transfusion of either stem cells only or the secretome using, for example, the nanovesicles of the stem cells, or even using cord blood itself.
You already mentioned some of diseases that you approach with this kind of treatment. Let's talk about all diseases that are suitable for stem cell treatment.
So far, we are having great success in treating stroke in adults. So overall, we have a response rate from 75 up to 80%. Treating stroke patients in between the first 16, 18 months after the onset of stroke. What we're also keen to treat, and with having great success, is so-called perinatal stroke, also well known as cerebral palsy in kids. So here, during the birth process, a little bit before, a little bit after, there's a kind of stroke pathomechanism ongoing in the brain. Using ischemia, leading to ischemia, and in consequence to neurological symptoms. Also in this kind of young patients, cord blood is a well-known source with great efficacy, and also for some patients, specific subgroup of patients suffering from autism.
Can you give us some examples of your most successful cases of this kind of treatments?
Yeah, many cases, but let's talk about one impressive case. Patient suffering from stroke, very well-known guy from the US, very sportive and very active, all-star player in soccer. And he was suffering from a specific so-called thalamic pain syndrome. So he's suffering from severe pain all over the body due to the stroke. So he was on morphine already. And on top of that, he was suffering from seizures. So kind of secondary epilepsy induced by the scar tissue in the brain due to the stroke. And after the treatment, half a year later, he was able, 6 months after the treatment with cord blood, he was able to dramatically taper down the morphine and get rid of the energetics, the morphines. And on top, 1 year later, he was able to completely taper down the anti-epileptic remedies because he wasn't suffering from any kind of seizure anymore. And the EEG showed absence of typical spike wave patterns for seizures. So he was absolutely free of morphines after a year and free of anti-epileptic remedies. So that was a great success for a stroke patient. Talking about cerebral palsy, many kids, they show being more active, having great improvement in their fine and gross motor function, showing more appetite, because some of the cerebral palsy kids also have a deficiency in appetite. The reduction of spasticity, that's a great success for many kids. And if you talk about a specific subgroup of autism, we don't treat any autism, but only specific kids with a specific kind of autism or autistic spectrum disorder. They are able to, for example, joining swimming lessons or going to a specific school, because they're able now to leave for at least a few hours the hands of the parents, because they can listen to the teacher. They know what the teacher wants from them. And also they starting to socialize, to finding friends, playing with the siblings, and being more aware of what's going on in their social fields. So these are the general perspectives as an example in a short period of time now of our success rates.
Can you give us some examples of promising studies and results regarding another placenta stem cells treatments?
Yeah, there we go. Thank you. Yes, if you look at the last decades, there are more than 1,000 clinical trials been happening already and been published, showing great success, specifically using placenta stem cells for degenerative diseases, which is the main focus is on pulmonary diseases like pulmonary fibrosis. We talk about metabolic diseases, including diabetes type 2, but also diabetes type 1. Yes, that's great success. If you imagine how many millions of people worldwide suffering from these metabolic diseases. Again, stroke, neurodegenerative diseases, including Alzheimer's, also including chronic heart diseases, ischemic heart diseases. Also, tissue engineering is a growing field where you can use specifically the placenta, donated, not yourself, from yourself. It could be used by donated placenta, using the stem cells for growing specific tissues, which is of interest. For example, heart valves. So you can individually design your own heart valve. Of course, that's an early step in science, but this is very promising for the future. But again, everything which comes to chronic inflammation and degeneration of tissue and organs, placenta has very great potential for the near future.
Are the stem cell treatments the future of anti-aging treatments?
Yeah, in general, if you look at stem cell approaches, it's pretty well known to use fat-derived stem cells from your own. It's specific stem cells from the bone marrow from the patient, but it's all invasive, and the capacity and the efficacy of these stem cells are age-related. So if you use it from a 50 or 60-year-old patient, when you have the need, the stem cells already lost a high degree of their regenerative potential. If you look at the placenta, it's not only the potential and the efficacy of the regenerative background, it's also the numbers of stem cells you can generate by the placenta, which is striking for regenerative medicine.
As a conclusion, what is the main argument for parents to choose the stem cell harvesting after birth?
It's an easy decision because it's non-invasive, and you take the placenta, and the second, baby is safe and mother is safe. So ethically, there's no concerns. Also medically, there's no concerns. And it's important to make the decision as early as possible because that's the one life chance only. Because usually placenta is trashed and then placenta is gone, and all the potential for the future and the kind of life insurance for the newborn baby and also for the following siblings. So, and as I said again, it's a one life chance, and on top, the potential and the efficacy of the stem cells sitting down in the placenta, that's the top and the gold mine of stem cells.
Thank you very much.